Every minute counts when it comes to stroke. Recognizing the warning signs early can save lives. From Senior Smiles, your trusted guide to healthy, active living after 60. Today we'll uncover 5 early stroke symptoms seniors 60, 70 and even 80 simply can't ignore. Stroke is a dangerous disease that occurs when the blood supply to a part of the brain is interrupted or reduced, causing brain cells to lack oxygen and nutrients, leading to damage or death of brain cells within minutes. For the elderly, especially those aged 60, 70 or 80, the risk of stroke increases significantly due to factors such as high blood pressure, heart disease, diabetes, atherosclerosis, and the natural aging process of the body. Early recognition of stroke warning signs is a key factor in increasing the chances of survival and limiting subsequent complications. Below are 5 early warning signs of stroke that the elderly must absolutely not ignore. The first symptom is an abnormal change in the face. Suddenly, one side of the face droops, the mouth becomes crooked, or it becomes difficult to smile or speak normally. This is a very characteristic sign of a stroke. If you ask an elderly person to smile, carefully observe whether both sides of the mouth are symmetrical. If one side droops, accompanied by a tingling sensation, it is an extremely dangerous sign. Some people may also notice that the eye on that side does not close completely or the eyelid droops abnormally. Do not think this is just temporary fatigue or age-related facial sagging, because a stroke can progress very quickly and cause serious consequences within minutes. The second common symptom is weakness or paralysis of the arms and legs, especially on one side of the body. Elderly people may suddenly feel that their left or right arm or leg becomes weak, unable to lift, or feels like no strength, paralyzed. Sometimes they try to hold something, but their hand trembles and drops the object, or when standing up, one leg cannot maintain balance. A tingling sensation may also occur, like ants crawling, pins and needles, or complete loss of sensation. If this symptom appears suddenly and does not improve after a few minutes, it is a warning sign of a stroke that should not be ignored. The third symptom is difficulty speaking or language disorder. Elderly people may suddenly slur their speech, stutter, or be unable to clearly express their thoughts. In some cases, they may not understand what others are saying or cannot find the words to respond. Sometimes they say meaningless, confused sentences, or completely mispronounce words. This is not a sign of senile dementia, but a sign of brain damage caused by ischemia. If your loved one suddenly has difficulty speaking, understanding speech, or cannot communicate normally, take urgent action. The fourth symptom is a sudden change in vision or loss of vision. Elderly people may suddenly experience blurred vision in one eye or both eyes, or even complete loss of vision for a few seconds to a few minutes. Some describe the sensation as like a fog covering the eyes, unable to see objects clearly around, or loss of spatial awareness. A stroke can affect the brain areas that control vision, leading to disturbances in recognizing images, colors, or spatial orientation. If any vision-related signs appear, especially in the elderly, immediate emergency care is necessary. The fifth symptom is severe headache or unusual dizziness. In some cases, elderly people experience a sudden, severe headache unlike any they have had before, accompanied by nausea, vomiting, or dizziness and loss of balance. Sometimes they feel spinning, the ground is rotating, or cannot stand steadily, walking unsteadily as if drunk. These signs may indicate a hemorrhagic stroke or cerebral ischemia, especially if the headache is accompanied by loss of consciousness, paralysis, or weakness in the limbs, or speech disorders. Emergency services should be called immediately. In addition to these 5 main signs, the elderly should also pay attention to secondary symptoms such as unusual drowsiness, confusion, disorientation in time and space, difficulty swallowing, or fainting. Stroke does not only occur in people with a history of cardiovascular disease or high blood pressure, but can also appear in completely healthy individuals, especially when resting, sleeping, or just waking up. The most important thing for the elderly and their relatives is to recognize warning signs as early as possible and take timely action. A simple but effective principle is FAST. F stands for face, A stands for arm, S stands for speech, and T stands for time. If there is any sign in the first 3 factors, remember that time is the critical factor for survival. Take the patient to the hospital as soon as possible. Do not wait for the symptoms to go away on their own, and do not self-medicate with painkillers or sedatives. In addition to recognizing symptoms, the elderly should proactively prevent stroke by effectively managing underlying conditions such as hypertension, diabetes, and high blood lipids, while maintaining a healthy lifestyle, avoiding smoking, limiting alcohol consumption, and engaging in regular appropriate physical activity. Regular health checkups, monitoring blood pressure, blood sugar levels, and blood lipids, and following doctors' instructions are important measures to reduce the risk of stroke. At the ages of 60, 70, 80, every minute that passes during a stroke can determine the ability to recover and the quality of life afterward. Never be subjective about any abnormal signs, no matter how small. If you or your loved ones show any of the above symptoms, act immediately. A stroke can take away the ability to move, speak, remember, or even life itself. But if detected early and treated promptly, the hope for a full recovery is entirely possible. Protect your health and that of your loved ones by being vigilant, proactively preventing, and acting quickly when necessary. Stroke does not discriminate by age, gender, or circumstances, but we can overcome it if we know how to listen to our bodies and do not ignore early warning signs. In addition to mastering the FAST principle, stroke prevention in the elderly needs to be carried out comprehensively and scientifically. First and foremost, effectively controlling underlying conditions such as hypertension, diabetes, dyslipidemia, and cardiovascular disease is a top priority. Many studies have shown that hypertension is the most common cause leading to stroke. Therefore, elderly people need to regularly monitor their blood pressure, adhere to their doctor's treatment regimen, and not arbitrarily stop medication or change dosages without professional guidance. Diabetes is also a potential risk because prolonged high blood sugar levels can damage brain blood vessels, increasing the risk of stroke. Regular blood sugar checks, following a proper diet, and gentle exercise will help better control the disease. Nutrition plays an important role in stroke prevention. Elderly people should build a balanced menu, reduce salt intake, and limit unhealthy fats from red meat, animal fat, and processed foods. Instead, Prioritize green vegetables, fresh fruits, fish, nuts, and whole grains. Drinking enough water daily also helps maintain the elasticity of blood vessel walls and reduces the risk of blood clots. Additionally, it is necessary to avoid alcoholic beverages such as wine and beer and minimize tobacco use, as these substances damage blood vessel walls, promote atherosclerosis, and increase the risk of stroke. Regular physical activity is an indispensable factor in stroke prevention. Elderly people should choose exercises suitable for their physical condition, such as walking, yoga, tai chi, gentle swimming or cycling for 30 hours to 45 minutes daily, at least 5 days a week. Exercise not only helps control weight and reduce stress, but also improves blood circulation, strengthens cardiovascular health and the nervous system. However, avoid overly strenuous exercises or sudden movements, especially in cold or extremely hot weather, to prevent adverse reactions in the cardiovascular system. Regular health checkups are an effective preventive measure that helps detect risk factors early and adjust treatment promptly. Elderly people should have a general checkup at least every 6 months, focusing on tests for blood lipids, blood sugar, heart and kidney function, and brain blood vessel ultrasound if necessary. Early detection of abnormalities will help adjust treatment methods and prevent stroke from the pre-disease stage. Besides direct preventive measures, maintaining a positive spirit, reducing stress, and getting enough sleep also contribute to lowering stroke risk. Prolonged stress increases blood pressure, causes arrhythmia, and promotes atherosclerosis in brain vessels. Elderly people should take time to relax, talk with relatives, participate in suitable social activities, or practice techniques such as meditation and deep breathing to reduce stress and improve sleep quality. Moreover, family and community also play important roles in preventing and handling stroke in the elderly. Relatives should observe and recognize early abnormal signs in the elderly, such as changes in behavior, speech, walking, unusual fatigue, or severe headache. When signs of suspected stroke are detected, stay calm, quickly call emergency services, and do not arbitrarily give medication or apply unverified folk remedies. Taking the patient to a specialized medical facility as soon as possible increases the chances of survival and recovery. Finally, elderly people need to improve their understanding of stroke through health education programs, community communication, and counseling from healthcare workers. Updating new knowledge and sharing prevention experiences among individuals will create a friendly living environment and reduce stroke risk in the community. In summary, stroke is a dangerous disease but can be completely prevented and controlled if elderly people proactively implement appropriate measures, combining control of underlying diseases, nutrition, exercise, regular health checkups, and maintaining a positive spirit. The cooperation between individuals, families, and communities will help build a safe living environment, enabling the elderly to effectively prevent stroke risk and enjoy a healthier, happier life every day. While quick action is critical, prevention matters too. Maintain a healthy blood pressure and cholesterol, eat plenty of fruits and vegetables, stay active with daily movement, and avoid smoking and excessive alcohol. Share this video with your loved ones. Your quick action could save a life. And don't forget to subscribe to Senior Smiles for more health tips and gentle routines to help you stay strong, vibrant, and happy at every age.